You got up from the couch a few minutes ago, walked up a flight of stairs, or hurried to catch the phone before it stopped ringing. Your heart rate jumped the way it's supposed to. But here's the question almost nobody asks. How fast did it come back down? Not whether it went up, everyone's heart rate goes up. The question is what happened in the 60 seconds after you stopped moving. Most people have never once paid attention to that number in their entire life, and it turns out to be one of the most quietly predictive numbers your body produces. I'm Dr. Ryan Walker. I'm a cardiologist, and I've spent 17 years reading exercise stress tests, treadmill results, and the small print at the bottom of cardiac reports that almost nobody, not even some physicians outside cardiology, stops to explain to the patient sitting in front of them. In 17 years of practice, I have watched this exact picture play out more times than I can count. A patient comes in for something unrelated, we run a stress test as a precaution, and buried in the data is a number that predicted trouble years before any chest pain, any shortness of breath, any symptom the patient would have noticed on their own. Most people have been told that the important number on a stress test is how high their heart rate climbs, or whether they can finish the full protocol without stopping. That advice isn't wrong, but it leaves out the recovery side of the equation entirely. And the gap between I finished the test and my heart rate recovered normally afterward can be the difference between a completely reassuring report and a warning sign your doctor may not have had time to walk you through. There's no controversy or cover-up here. This is published, peer-reviewed cardiology, not a secret. But there is an incentive problem. A routine appointment runs 12 to 15 minutes, and explaining a heart rate recovery curve properly takes longer than that. So it gets mentioned, if at all, in a single sentence, and the patient moves on without understanding what they were just told. That's not because anyone is hiding something, it's because there's no billing code for a proper explanation, so I'm going to give you one here. And this signal has nothing to do with cholesterol panels, blood pressure cuffs, or anything you'd find on a standard lab requisition. Researchers at the Cleveland Clinic followed thousands of patients undergoing exercise testing and found that an abnormal heart rate recovery, meaning the heart rate drops by less than about 12 to 18 beats per minute in the first 60 seconds after stopping exercise, was tied to more than double the risk of death over the following years, even after accounting for the severity of visible artery blockages on angiogram. Let that sink in. This wasn't a stand-in for disease you could already see. It was adding new information the angiogram alone couldn't tell you. Before we go further, tell me in the comments, when's the last time you checked your own pulse for a full minute after doing something physical, climbing stairs, a brisk walk, gardening, not your resting heart rate in the morning, but how quickly it settled back down? I read every comment, and I want to know how many of you have ever actually watched this happen in your own body. Here's the mechanism, and I want you to picture something you already own. A dimmer switch on a light. When you flip a normal switch, the light snaps on and snaps off. A dimmer switch fades, it takes a moment to rise and a moment to fall back down, smoothly, under control. Your heart rate under a healthy autonomic nervous system behaves like a dimmer switch on the way down. Effort ends, and the vagus nerve, the body's built-in braking system for the heart, steps in almost immediately and eases the rate back toward baseline in a smooth, fast curve. When that vagal braking system is worn down or damaged, the light doesn't fade, it just kind of hangs there, stuck brighter than it should be for far longer than it should stay lit. That lag is heart rate recovery, and it's measuring the strength of your parasympathetic or rest and digest nervous system's grip on your heart. This matters more specifically as we age because of something called autonomic dysfunction, which is simply the gradual weakening of the nervous system's fine control over involuntary functions like heart rate, digestion, and blood pressure regulation. Autonomic dysfunction doesn't announce itself with a single dramatic symptom. It shows up as a slightly slower recovery here, a slightly blunted response there, quiet erosion, not a crash. A large meta-analysis published in the Journal of the American Heart Association pooled multiple prospective cohort studies and confirmed that a blunted heart rate recovery was consistently linked to a higher risk of cardiovascular events and death across different populations, independent of traditional risk factors like blood pressure and cholesterol. Independent meaning even people with otherwise normal numbers on paper showed increased risk if this one recovery curve was abnormal. Researchers double-checked this finding across cohort after cohort because, on its own, it sounded almost too simple to be meaningful. It held up anyway. I want to describe a type of patient I see regularly because the pattern repeats so often it's become instantly recognizable to me. I'll call her Diane, in her early 60s, the kind of person who walks her dog every single morning without fail and has never smoked a cigarette in her life. Diane came in for a routine physical, not because anything felt wrong. Her primary doctor had noted, almost in passing, that her heart rate stayed a little high after a treadmill test the year before, and had chalked it up to nerves about being at the doctor's office. When we repeated the test and actually timed her recovery curve rather than glancing at it, her heart rate was still elevated well past the 1-minute mark, consistent with the abnormal recovery pattern described in the research. We didn't panic. We adjusted her training, shifting some of her daily walks toward intervals that specifically challenge and then rest the cardiovascular system, which is one of the few interventions shown to improve vagal tone over time, and rechecked her in 4 months. Her recovery curve had visibly steepened. She was back in a more typical range, and she told me her dog now has to work to keep up with her, not the other way around. If nobody ever sat you down and explained what your own stress test results actually meant beyond everything looks fine, tap subscribe, because that's exactly what this channel exists to do every week for free. Hit like if you learned something today that your last appointment didn't have time to cover. And if you know someone who's had a stress test in the past few years and was told the results were normal without much more explanation than that, send them this video. So here's what you can actually do with this. You don't need a treadmill lab to get useful information. After a bout of real exertion, brisk stair climbing, a fast uphill walk, anything that gets your heart working, find your pulse at your wrist or neck and count the beats for a full 15 seconds, right as you stop. Then again, exactly 60 seconds later. Multiply each by 4 to get beats per minute. You're not diagnosing yourself. You're building a personal baseline the same way you'd track your resting heart rate or your blood pressure at home. Do this every week or two, ideally after a similar type of effort, so you're comparing like to like. Over weeks and months, a curve that's flattening out, recovering faster, and by a larger number of beats is a genuinely reassuring sign about the state of your autonomic nervous system. A number that consistently barely moves is worth bringing to your doctor and asking directly, can we look at my heart rate recovery on a formal stress test? The habit that improves this recovery curve most reliably in the research is a mix of moderate aerobic activity and short bursts of higher intensity effort, what's often called interval training, because it repeatedly exercises the exact on-off braking mechanism that heart rate recovery is measuring. Pair it with consistent sleep timing if you can manage it, because the same vagal system that governs your heart rate recovery also governs the transition into deep sleep, and disrupted circadian rhythm blunts vagal tone the same way poor fitness does. The two reinforce each other at the level of the same nerve. What we've talked about today isn't really about a number on a printout. It's about the gap between finding out your heart is struggling only after a serious event forces the issue, versus catching a slow-moving warning sign years earlier while you still have every option available to you. Your autonomic nervous system responds to training. It is not fixed in place. It just needs a reason to adapt. Starting tonight, pick one stair climb, brisk walk, or other bout of moderate exertion you can do in the next 24 hours, and time your heart rate at the moment you stop and again 60 seconds later, so you have your own first data point. Write both numbers down somewhere you'll actually see. Again, a note on your phone works fine. If your primary care doctor has ordered a stress test for you in the past, call the office and ask them to specifically pull the heart rate recovery value from that test, since it's often recorded but rarely discussed. And if you haven't moved your heart rate up in weeks, a 15-minute brisk walk today is enough to start generating useful information about your own recovery pattern. One important caveat: if you have a diagnosed heart rhythm condition, take a beta blocker or other heart rate controlling medication, or have been told you have heart failure, your heart rate recovery numbers will be altered by that medication or condition, and you should interpret any changes only in conversation with your cardiologist, not on your own. A lot of you are going to walk away from this video wondering what a genuinely healthy heart rate response to daily stress, not exercise, but mental and emotional stress actually looks like, because that's a related but separate piece of this same nervous system story. There's a specific pattern called heart rate variability that measures something adjacent to what we covered today, and it's changed the way I think about stress management in my own patients. I've made a video walking through exactly what it is and how to start measuring it. I'll link it right here. Have you ever noticed your heart rate staying elevated for a long stretch after you've stopped exerting yourself at the gym, on a hike, or just climbing your own stairs? Tell me about it in the comments. Your experience might be exactly the nudge someone else watching this needs to finally get their own stress test results explained properly.